statement.
Thank you, everyone, for being here today to discuss cybersecurity in healthcare and the recent Change Healthcare cyber attack. While I'm disappointed that United Health Group chose not to make anyone available to testify today so that the committee and the American people could hear directly from them about how the specific cyber attack occurred, I will note United Health briefed E&C members recently on the matter and have committed to testifying at a future hearing. Healthcare cybersecurity was already a concern before the Change attack, and I look forward to today's discussion about what the federal government, doctors, hospitals, and others have done right, and where there is opportunity to improve the resiliency of the healthcare sector. The Change Healthcare cyber attack is not just the most recent case of ransomware targeting our healthcare system, and due to Change's integration with so many of our healthcare providers and payers, it is still impacting providers and healthcare organizations across the country. I have heard concerns from providers, rural hospitals, and many others, all worried about what this cyber attack means for them. And just this morning, the Change Health hackers were posting stolen data from the ransomware attack. There are still many unanswered questions and lessons to be learned from this attack. How did this attack gain entry to the Change system? How can hospitals, doctors, and others best protect themselves? What other third parties do our nation's healthcare providers rely upon, if taken offline, could have a similar negative impact on the U.S. healthcare system? Healthcare infrastructure is crucial for patients receiving the care they need, and sadly, this will likely not be the last breach or ransomware attack that will happen. Patient data is valuable, and it is housed online. That is why we must continue to examine healthcare cybersecurity and make sure that patient data remains protected. HHS has overall responsibility for ensuring cybersecurity within healthcare across the United States federal government. And the Administration for Strategic Preparedness and Response, or ASPR, has been designated the one-stop shop responsible for leading and coordinating the cybersecurity efforts, both within HHS and external partners. However, there seems to be multiple offices and agencies that have some role in cyber response. The Office of Civil Rights, the HHS Chief Information Officer, the Office of National Coordinator, and then the most recent response, CMS, all played a role. As our healthcare system becomes more consolidated, the impacts of cyber attacks, if successful, may be more widespread, pulling in even more agencies and offices within HHS. This committee has led at examining cybersecurity across all sectors. In 2019, Congress made explicit that part of the responsibilities of ASPR is preparedness and response to cyber attacks. In 2020, a bill led by Dr. Burgess, which passed through this committee, encouraged healthcare organizations to adopt strong cybersecurity best practices. Last Congress, this committee worked to give FDA more authority over cybersecurity of medical devices. And more recently, in the reauthorization of the Pandemic and All Hazards Preparedness Act, reported by this committee, we made it explicit that cybersecurity should be considered and prioritized as a part of ASPR's National Health Security Strategy. And the Energy and Commerce Committee will continue leading the way in examining this issue. I hope we can use this hearing today to learn more about the Change Healthcare cyber attack and the response. Is it a unique situation? What do providers and patients need to know and look out for? I don't want this committee to be back here in 5 or 10 years after more patients' healthcare is disrupted by known criminal actors finding vulnerabilities in cybersecurity of our healthcare system. To prevent that, I look forward to hearing from our witnesses about what can healthcare learn from other sectors. Are there more federal authorities HHS needs? What is the best balance to get better adoption of existing cybersecurity practices? And I look forward to the discussion and yield back. Thank you, Mr. Chairman.